This is a recorded lecture for information technology for healthcare professionals. And what we're going to look at in this chapter 12, or final chapter, is really security and privacy in the electronic age. Clearly, there's a greater ability to abuse and misuse information in the world we have today because it's so much more extensively available. So we're going to talk about mechanisms in healthcare that we utilize to sort of manage that. When you look at privacy and security, many companies and some government departments have lost, misplaced, or sold confidential information inappropriately, with some of it being medical. With the 2014 as a target year for computerized medical records, effective security for the privacy of computerized information is not only a necessity, it's absolutely imperative because we want our medical history to be portable from one place to another. We have to go vacation or visit somewhere else. On the other hand, we'd like it not to be public knowledge in some cases. Threats to information technology, crimes such as spreading viruses, computer viruses, natural disasters such as flood or fire, human error, all those things can be threats to technology as far as its utilization or its exploitation. Computer technology has led to new forms of crime, obviously, crimes using computers and crimes against computers. Most are both using computers to harm other computers or to get access to sensitive information. Now, computer crime, one of them is spreading viruses, where programs that reproduce themselves and actually disable computers that they are inserted in. There are some hackers that just do that for sport, and they can, and some governments do that for sport, for other governments. So it's not just the private person that's doing that or a company that's doing that. It could be a government that's perpetuating that. We also have theft of information, where we break into private databases such as hospital databases, and we start misusing that information. We have theft of services, where somebody may steal cable TV access. We can use it for fraud, use a computer program to illegally transfer money from one account to another. Or software piracy, where we illegally copy copyrighted software, and that is most certainly a crime that's being prosecuted more and more. We can also it also can apply to identity theft. An identity theft thief needs only a few pieces of information, like a social security number or mother's maiden name, to steal your identity. Among those who find out who stole your identity, half are members of the family or household of the victim. So most people who are doing identity theft are literally relatives. Many states have passed laws against identity theft. It's absolutely debilitating. It takes away your ability to get credit, to have access to even a driver's license in some cases. Identity theft is now at a low point. In 2010, the average amount that fraud victims had to pay had decreased from $387 to from $387 to $681 due to new account fraud. In 2009-2010, data breaches which put your identity at risk have increased 33%, or 1/3. So they've increased significantly. Spyware, software that can be installed without users' knowledge to track their actions on a computer. There is now new software, new hardware, if you will, that are inserted into ATMs that look like part of the ATM but will read your card and your information, and then the person that has that information can use that information to buy other stuff. Adware, which can display unwanted pop-up advertisements on your computer, or that may be related to the sites you search on the web, or even the content of your email. So this adware may give you access. Now, there are current threats to computer systems. For instance, a fraudulent dialer can connect the user with numbers without the user's knowledge, can connect the user's computer to an expensive 900 number, and there's a process called phishing, P-H-I-S-H-I-N-G, which involves sending fraudulent messages via email or instant message that can purport to be from a legitimate source. So they can create this message that makes you open yourself up to potential harm. There's also what's called a Trojan horse, and like the Trojan horse in ancient Greece, it appears to be a normal program, but inside it has these malicious functions that can disable your machine or give the perpetrator access to some of the data on your machine. There's something called an email bomb or denial of service attack. It sends so much email to one address that the server stops working. Botnets can remove software or send spam. So they're mechanisms that you have if you don't have a good software that sort of covers that, then that's a problem. Current threats to computer systems include key logging, can be used by anyone to track anyone else's strokes. For instance, they can be inserted on the computer, and then what that person does can be seen by somebody else. Now that's used in policing also now, especially cyber policing. So if you perceive that somebody is doing something fraudulent in your company, you can add a key logging software to it, and you can monitor what they're doing and then document if they're doing anything fraudulent. We have malware, includes many forms of malicious hardware, software, and firmware. The SpyBot search and destroy software can remove malware, adware, spyware, fraudulent dialers, and keyloggers from your computer. And there are several programs that are available now to do that. Now, security systems try to protect computer hardware, software, and data from harm by restricting access by trade employees and passing laws. But attempts at restricting access, for instance, through PINs, personal identification numbers, or passwords, locking computer rooms, and requiring an employee to carry ID cards and keys, all those are mechanisms to control access. We also have biometric methods, fingerprints, which you even have on my telephone even has, you use a fingerprint to get in and out of your phone. So you can't get into my phone without using my fingerprint to get into it. We have handprints in some cases. They can do retina or iris scans. We have lip prints, believe it or not. Facial thermography, because that's pretty consistent, people. You can use those methods to determine whether the person in front of you is the right person. Biometrics can also include body odor sensors. Interesting. Facial structure scans. You want to take a bath every day, I guess. Facial structure scans. Iris and retinal scans. Keyboards that can identify a person by behavior, fingerprint, voice, or gait even. But none of these methods is foolproof, and every one of them can be circumvented. On April 12th, 2011, the Assistant Director of the FBI Cyber Division, Gordon Snow, told the Senate Judiciary Crime and Terrorism Subcommittee that criminals can penetrate any system that is accessible from the Internet. And so that's a real problem, is being able to develop not just one response, but multiple layers of response. First of all, that tell us it's happening, and two, are able to sort of counteract that. This means that continue the government networks and the nation's critical infrastructure could be degraded, disrupted, or destroyed. And even when a crime is detected, it's very difficult sometimes to know where it originated or who did it because of the ways that the hackers can hide their traces. No security system is foolproof, these backup systems. A backup system is necessary to maintain copies of the data, copies of software, and it should be off-site. So if you have, for instance, you can even do that privately. I'm not suggesting you buy this stuff, but I have a online software system that automatically reproduces or makes copies of every single file I produce on my computer and stores it on a web page. Not a web page, but on a hard drive on the web, on what you might call a cloud. And that means if my computer blows up, then I can just simply reload a new computer, call up that place, and it'll download all those files back so I don't lose files. And if you ever lost files because the computer broke down, you understand what that means. And even at this point in my life, losing any files that I use now would be detrimental. This is federal laws intended to protect computer systems and privacy of the individual. Goes through that process: the Fair and Credit Reporting of 1970, the Privacy Act of 1974, the Right to Financial Privacy Act of 1978, the Computer Fraud and Abuse Act amended in 1984, which was amended in 1994, the 1984 Cable Communications Policy Act, and the 1986 Electronic Communications Privacy Act. All those are mechanisms or laws, if you will, that manage that process. This goes on, and I'm not going to read each one of these, but you can see there have been multiple attempts to control and to legislate access or inappropriate access, and this goes on, if you will. So privacy refers to the right to control your personal information, and that's an important issue not only in your social world, but in your medical privacy world. Threats to privacy: government databases are maintained at the local, state, and federal level, include tax information, welfare information, property ownership, driving records, criminal records, and these are becoming more and more accessible, these things specifically, to the public world through the Freedom from Information Act. Radio frequency identification tags are being used. The FDA has approved the tags for medical use. These chips are very easily counterfeited, so they can attach something to you and then track you inappropriately or illegally. There are legal restrictions on the federal government and what it does with information it collects, simply like wiretapping, listening on telephone calls. There are few restrictions on state and local jurisdictions, however, so some lower local jurisdictions can sell information, and some put the information on the internet. One of the things, for instance, some states are doing that if somebody is done something criminal, if they're picked up or whatever, they have a police log, and that's put on the internet so people can see it. Private databases are maintained by corporations interested in buying habits of personalized advertising. So these private databases may track you and see what you buy, what you look at on the internet, have these cookies that sort of pick up what you're doing. These databases hold information on your buying habits, your credit rating, your health information, as well as your reading habits. Databases online with information are available for a fee, so they can be sold if you want, people want to. And information from government databases can be linked to private databases by using Social Security numbers. So people who want to access your government information can do so if they have access to your Social Security number. Now, the Real ID Act of 2005 directly imposed prescriptive federal driver's license standards by the federal government on states, and it requires every American to have an electronic identification card. And it does that for a couple of reasons. So that card can be used to authenticate who you really are. It required state DMVs to share all the information in their databases with all of their states' DMV databases, which creates this huge database. So if a person had a criminal driving record in one state, before this was enacted, they could go to another state, get another driver's license, and they could start over again. In this case, it didn't allow that. But in 2011, according to some sources, the Real ID Act had been put in limbo after 25 states adopted legislation opposing it. And they did that because they felt it was an invasion of privacy. I'm not so sure that's true. Let's talk about privacy, security, and health information in HIPAA and high-tech. HIPAA, Health Information Portability and Accountability Act of 1996, is the first federal legislation to put a national floor on the privacy of medical information. And high-tech extends that privacy protections, which were enacted originally by HIPAA. HIPAA and high-tech encourage the use of the electronic medical record, and encryption protects privacy. So we have this electronic medical record, but the information is encrypted so it's not easily accessed. HIPAA requires healthcare facilities, protected entities, to conduct a risk analysis and to address those risks. And it has a timeline that they must react in. Until recently, the Department of Health and Human Services preferred to work for voluntary compliance and settle complaints through corrective action plans. But now recently, that's becoming more active. In 2008, for the first time, a covered entity was required to pay a fine. So if something happened, they would fine them. For instance, after receiving 31 complaints about one company, the OCR and CMS investigated and required to pay $100,000 in fines. There's also been an increase in criminal prosecutions by the Department of Justice for people that inappropriately access HIPAA information. Now, MIB Group Incorporated is comprised of 470 insurance companies, and it contains health information on 15 million people. And according to Business Week, 2/3 of all insured companies are using consumers' medical histories and personal information to deny coverage, charge higher premiums, and exclude certain medical conditions from policies. When you start talking about the National Health Care Act, we call the Obamacare, that's trying to circumvent some of these restrictions. So if a person, for instance, was working for a company, had health care, and their child had a chronic disease, they could go to a new business, have a new health care, and they could be denied coverage because of pre-existing disease. Now, this contains health information of 50 million people. However, the MIB Group it denies this, stating that MIB members are strictly forbidden from using MIB information about you as a basis for determining your eligibility for insurance. I hear that, but the documentation doesn't suggest that. MIB members only use MIB's information as an alert or red flag, which prompts them to obtain additional information through traditional underwriting tools and methods. That's kind of a sidestep. And what that means is they use these red flags, but they're using it to identify patients that they may not endorse or may not insure based on pre-existing conditions or something else. Now, in data warehouses, there are some private data warehouses that exist for the sole purpose of collecting and selling personal information. They sell information to credit bureaus, to employers for background checks, and on and on. These electronic databases are now being linked into larger and more comprehensive super databases, so the world has more and more information about you. The USA Patriot Act weakens the privacy protections and requires institutions to give government agents information without informing the person that they're giving the information is being given about. Now, the future of privacy and medical information under HIPAA and the USA Patriot Act, which works against privacy, is not yet known. There have been many gray areas that have been crossed. Other privacy issues: telemedicine. Telemedicine raises the issue of privacy and the fact that medical information is now on networks. Information can more routinely cross state lines. For instance, telemedicine may supply medical care information across one state line to another, maybe several state lines. Other privacy issues: email. And email is not legally private. People think it is. When your company starts to read your email, you say, well, that's a privacy issue. The truth is, your access to email in that company, if you use company email, is not your own. So email in healthcare setting can be read by many people, including clerks, secretaries, and healthcare providers. In offices that use email, you need to inform the patient of who will read it, what issues may be mentioned in emails, and the turnaround time, so they understand what's going on. Other privacy issues: genetic information. As research focuses on genetics, an individual's genetic probability of developing certain diseases, privacy issues arise. For instance, maybe insurance companies won't take a person on to insure them if they know they have a genetic issue, which may not show in a disease yet, but genetically predisposes them to certain diseases. GINA, the Genetic Information Non-Discrimination Act, became law in 2008. Basically proposed it to protect people from discrimination by health insurers and employers based on genetic information. Well, it says that, but that has really been compromised again and again. The latest updates on GINA, effective in 2011, clarify who the law covers and regarding employment, applicants, trainees, apprentices, and current and former employees. So we're starting to become clearer on that identification. The electronic medical record for other privacy issues. Electronic medical record, EMR, like other information in electronic form, is not totally secure. So HIPAA and HITECH encourages use, but HIPAA and HITECH require security measures for all personally identifiable medical information. So encryption is one of the major ways that we can limit access to that information. Now, security breaches, events that potentially put a person's name, social security number, driver's license number, medical record, or financial record, credit or debit card, potentially at risk, either in electronic or paper form, are called security breaches. And a security breach, as of March 17, 2011, OCR has posted on its web 249 breaches. The breaches affected 8,029,236 individuals. The dates of these breaches range from September 22nd, 2009 to January 12th, 2011. So it really looked at where the security breaches are and who was involved. Most of the breaches were covered were covered entities, but some involved business associates. So if I bring a consultant in to my healthcare facility to improve something, they may have access to personal patient information, and I may have them sign a compliance contract, but they still may misuse that information. HITECH extended HIPAA's privacy protection to include those business associates of covered entities. Originally, they were not covered, so they could misuse the information and had no downside. Now with HITECH, the extension of HIPAA, then we're starting to see some of that take effect. Conclusion: if medical and health records are digitalized and put online, HITECH requires them to be encrypted. A national database of health records could improve health care by making all your medical information, including allergies, medications, and most recent test results, available in any hospital, doctor's office, or emergency room, but it comes with a risk, and that is other people may inappropriately develop access to that. Currently, data is not secure as a result. So marketers can tailor advertising to people with particular diseases. Lenders can disqualify people on the basis of an estimation of how long they would live. Employers can deny employment or promotion, although that's not legal. They can do it in a more subtle way. It's interesting. I've even seen it on Facebook where, just to let you know, I'm a Pittsburgh Steelers fan. And so somehow Facebook advertisers have discovered that I'm a Pittsburgh Steelers fan, and I'm starting to see market pictures and market areas that are suggesting I buy this Pittsburgh Steeler whatever. And we're starting. My wife is a fan of a different football team, and so she's even starting to see those advertisements coming to her. So there's a database that's being collected and utilized to manage the advertising even on Facebook, probably even especially on Facebook. This concludes the last chapter of this text. Thank you very much.